probably the one most relevant to all of us is the best estimate is that about 40% of viral transmission occurs from person to person prior to the development of any symptoms. So let's just call it roughly half of transmission occurring before the person is aware that they have any symptoms, emphasizing the need for continuing the social distancing, masking, and hand hygiene. The other thing is we've talked a lot about the so-called R0 or reproductive number of the virus. Again, that's a metric that tries to measure if I were to become infected, on average, how many people do I infect? And when you look across countries, that number varies quite a bit from about 2 to 6, with the average being around 2 to 3. So I think the R0 is higher than we initially estimated, and that makes sense. That's our common experience as we're looking at about 1.6 million cases in the US with almost 100,000 deaths. It fits with that. But here's the interesting thing. When you actually look at the math, and I worked that out, so an R0 of 1 means that on average I infect one other person, okay? If the virus had an R0 of 1, after 60 days, you'd see about 14,000 cases. An R0 of 1.1 leads to 25,000 cases by 2 months. So you see the exponential, not linear, the exponential rise in cases, which is why the social distancing and the masking is such a powerful thing that we can do in terms of suppressing that number of cases. The other thing is we've learned a lot, actually very recently, about this multi-system inflammatory syndrome that occurs oddly all the way up until the teens, even young 20s. This is important because we tend to think young people having very mild disease, et cetera. But across the US, an estimated 350 confirmed and probable cases are being investigated in association with COVID-19. We've talked before about the multi-system dimension of this disease, and we're certainly seeing that play out in terms of the effects on the heart, particularly. One question that has come up, because it did come up with SARS, is could this virus be excreted in the feces? So would there be any oral fecal route of transmission? And a group of Chinese investigators has actually cultured it now out of stool and demonstrated that, yeah, it's live virus that can infect. So we've learned a lot, and that's just a sprinkling of what's been learned.